show, and this is Brent and Ron for our next segment, and I want to welcome Jim Skinner, who is the president of Smart Patient Academy, to the program. Welcome, Jim.
Thanks, Brent. Thanks, Ron. Appreciate being here.
Yeah, thank you so much for joining us. Now, tell us a little bit about Smart Patient Academy, and then we'll dig a little deeper into some more of the granular pieces of your business.
Yeah, Smart Patient Academy was really designed out of kind of a curriculum of having done enrollment meetings. There's two businesses I have. One is a consulting and brokerage benefits firm. And over the course of time, my staff and I have done about 1,000 enrollment meetings. Starting in 2006, we started to work with consumer-driven healthcare plans, and specifically HSAs and wrap plans with HRAs and those kinds of things. And they got very complex. We realized that the consumer had no clue how anything worked, much less their basic PPO plan with copays. And to transition these people into a more complex environment where they move from being a passive consumer to being an active consumer was not taking place. And that's really necessary if you're going to do any kind of consumer-driven healthcare plan. You need the employee or the patient, the consumer, whatever we want to call them, to be cognizant of the risk and the cost shift that's come in their direction. And a lot of people are buying these plans just because they're less expensive. And so the bottom line is Smart Patient Academy was created to train employees and consumers on how to use their health insurance. Mm-hmm. So it's really born out of experience, of my own experience, actually, as being a consumer of healthcare as well. So
now, one of the things that we always talk about is how do you help your employee population really empower them to become better consumers of health and healthcare. And then on this, on your description here, you have high touch messaging in a high touch world, and it is all about communication right now. Because to your point, consumers, our employers might be flipping the switch to say, hey, you got to become a consumer of healthcare tomorrow. And how do we really understand how to do that, or do we?
Well, that's the whole point, is we don't. And there's a chapter in the book that I wrote, a book called Smart Patient, Smart Money, which is a publication of Smart Patient Academy. And basically what it is it's designed to actually train the consumer on how to use the plans, because it's not happening. Mm-hmm. There's a huge cost shift going on to employees, and they're completely unprepared. And most HR managers I deal with are very, very concerned about their employees, buying a plan simply because it is less expensive. Mm-hmm. And the reason is that when they actually go into a doctor's office, they can experience a very hostile environment. There's two parts to the consumer experience when they're consuming healthcare. There's the financial experience. There's actually the delivery of healthcare. The delivery of healthcare may be very empathetic, and it may be very supportive, but the financial side is just the opposite. And so we've trained people over the last 30 years to be very passive as consumers of healthcare, the actual delivery of care, and now we're telling them to be very active and get involved in price negotiations. They're going into an environment where nobody knows the price of anything. The people at the front desk in a doctor's office frequently misinform the consumer that they have no insurance, when in fact it's just a high-deductible health plan. Mm-hmm. So there's a huge niche here that's missing. There's a huge training niche that is missing, and that's really what we do. And so the other piece of that puzzle that you mentioned was, as an industry, when we go out to explain consumer-driven healthcare, that language is all academic and financial, and it really doesn't connect with the consumer or employee in a meeting who's just been diagnosed with diabetes, say. I mean, they're concerned, yeah, great, the premium's lower, and you've got some pre-tax dollars to spend on your out-of-pocket expenses, but what about the delivery of care? Mm-hmm. That's where the rubber meets the road. That's where these guys want to know, how does consumer-driven healthcare change the delivery of healthcare to me?
Well, Jim, this is Ron Bachman. A couple questions. You're right in the middle of the activity of changing the behaviors and helping to support that with your programs, your communication, your educational parts. A lot of people that are skeptical of this whole movement of consumer-driven healthcare, high-deductible plans, are kind of wondering, how does it actually change? What change in behaviors are you really seeing? What are the areas that maybe patients start to make some changes that then feed into the more complex? Are they starting off with, prescription drug costs, the use of emergency room, or is it in the higher, chronic and persistent cases of diabetes or asthma or congestive heart failure? How are patients really changing based upon the services you're providing?
Well, great question, and I'll give you two examples. All right, the answer is that it's changing the delivery of healthcare at a very basic level and a very complex level. The entire spectrum changes in the delivery of care. When the patient is taking personal responsibility, it changes the relationship and the parameters in which the doctor's prescribing something to you. When you start asking questions about the necessity of an MRI that he just routinely prescribes, or he gives you Zocor when in fact there's Simvastatin out there for $4.99. Here's an example. One of my clients read the book, discovered that Costco was a much less expensive place to go get prescriptions than Walgreens.
Right.
So they call up Walgreens and they say, hey, listen, I've been with you for 6-7 years. I want to transfer, though, all of my scripts over to Costco. The guy goes, why do you want to do that at Walgreens? And the consumer says, well, they're less expensive. So the pharmacist says, I tell you what, how about we do a price match on everything you could get at Costco, A, and B, let me give you a $50 gift certificate to go ahead and start shopping through our store. Would you stay with us? Absolutely. Mm-hmm. I'd stay with you. Now, that's a really easy thing to do. But until you've told consumers they can actually do that,
right,
they have no clue. Mm-hmm. But mm-hmm. in the way more complex arena, it's for example, here's an example I had personally, and basically had a brain tumor. So I told you that a lot of the book and a lot of what I do is out of personal experience. And so what ended up happening was there's two types of neurosurgeons, one being a gamma knife type surgeon who's non-invasive, and then traditional brain surgeons. Well, they argue like Republicans and Democrats about the value of each other's approach. So it's really next to impossible to reconcile when you're talking to one versus another. And I won't go into all great details, but at the end of the day, what I was able to do as a very active consumer was to organize a group of neurosurgeons, of 12 neurosurgeons of both types in San Antonio and another 22 out in California. And as a group, they both came to the recommendation of giving gamma knife surgery, but individually they would have argued about the delivery of care.
Right.
That's a perfect example of how an active consumer can turn the services to your advantage.
Right. They always say, like, surgeons like to cut, so their hammer is looking for nails, and so you do have to be careful. Now, I noticed in your title of your organization is Smart Patient Academy, and of course we use the term consumer-driven healthcare, consumerism. We even use the term, the Institute for HealthCare Consumerism. And I'm one who, I don't like the term consumer because it sounds like all the burden falls on the consumer, and people don't really think of themselves as consumers most times in the healthcare system. They do think of themselves as patients. So I love the fact that you call it a Smart Patient Academy. a lot of what we've talked about already today is how the member interprets their plan and takes action. We at the Institute for HealthCare Consumerism have begun to focus on the idea that the relationship for consumerism shouldn't just be on the plan member, the consumer, but it should be on improving the relationship between the patient and the provider. That's a subtle shift, but a very important shift in thinking about services. How does it improve the patient-provider relationship? And certainly your education and information gives a more informed patient, along with their physician, to make better choices like you're describing. Could you focus on that a little bit? How does this service that you have improve the patient-provider relationship?
Well, we kind of look at this marketplace as a supply and demand. So the supply being the physicians, the demand being the consumer, right, patient, whatever we want to call them. So from, we've talked about the consumer as being more assertive. When you walk into a doctor's office and you're more assertive, it assumes that you're going into a provider's office who's receptive to this new change. Mm-hmm. So on the supply side of the equation, I think that's the next missing piece of the puzzle is we need to prepare the providers mm-hmm. to be ready for consumers who are going to be much more assertive in their role. And I will tell you, I actually have many doctors as clients, and they're not prepared. And some of them are very, very resistant. So, yeah, there needs to be a big movement in that arena. But how does what we do change it? I think it's just the demand from the consumer to be treated like a consumer. Mm-hmm. Will mm-hmm. change the behavior of the doctor. At the end of the day, when the doctor's told, they're shocked when they hear this, when the doctor's told that your pricing model and the way you're going to charge me just doesn't work for me, mm-hmm. I'm going to go down the street, and they hear that often enough, maybe they'll change their behavior. Maybe their tone will change. I don't see this universally, but it's certainly a paradigm shift for the providers as well as the consumers.
Sounds like there might be an interesting market for a smart provider academy.
Well, I'm glad you brought that up. We actually are creating something called a Friendly Biller Network, which is a designation for doctors who are transparent in their pricing, and also are their whole business model is to treat their patients as customers. And and actually, I'd love to team up with you guys on the distribution of that model, so we can talk about that.
Sounds very interesting. Yeah.
Now, Jim, as we wrap up the show, kind of give us one or two good takeaways for the audience about your business, and then let us know where they can find you. We got about 30 seconds.
Okay. All right, so the ROI, if you're running a big company, your ROI on your healthcare spend really depends on employees understanding, appreciating, and knowing how the plans work. So if you're not training them on how to do it, then you're really losing a lot of the potential ROI. So that would be one of the major takeaways. So Smart Patient Academy is really designed to have that high-touch communication to your employee group and train them to move from being passive to active consumers. So how could they reach me? SmartPatientAcademy.com has contact information, has links to a lot of what we're doing.
All right. Thank you. Hey, Jim, thank you so much for joining the program today. To our audience out there, stay tuned for the next segment of HealthCare Consumerism Radio.
Thank you.
This is Ron Bachman.